Singapore has signed a deal for a new drug to treat COVID-19 developed by Merck and described by some doctors as a game changer. Called molnupiravir, the pill will be available here once it's received authorization and approval for use. Data from clinical trials suggests the drug works the best when taken early in the course of infection. And it's said to be effective against all known variants of the virus, including Delta. The drug may also reduce the chance of hospitalization or death by half for patients who are at risk of severe disease. Merck is known as MSD outside the US. Other countries in the region are also in talks to buy the drug. And just today, Australia's Prime Minister explained why the country is buying 300,000 doses.
What it means is that it seriously reduces the chances of you getting severe symptoms if you actually get COVID. But don't forget, you reduce your chance of ending up in an ICU from the vaccine by almost 90%. I think it's 86%. So vaccine first. But these treatments means that we're going to be able to live with the virus. So even in the unfortunate situation, if you do contract the virus, then we'll have the treatments to ensure that we can lessen these symptoms, reduce the chance of you ending up on ICU, which can put pressure on the hospital systems.
To share more is Dr. Leong Ho Nam, an infectious diseases specialist from the Rofi Clinic. Welcome back to the show, Doctor. How is this new drug different from other COVID-19 treatments out there, Doctor?
Great question. The current treatment which we have now is intravenous, which means you have to give it in a hospital setting. It's going to be a bit expensive. Administering it is kind of difficult. Whereas a new drug, molnupiravir, it is taken orally, which is very convenient. You can imagine having it at the GP clinic. In addition, it is treated very, very early in the illness where you try to control the virus replication. So the approach and what we are targeting is completely different now. So it adds an extra armament in our fight against COVID-19.
And you've called this new drug a game changer. Can you elaborate on that?
It's a game changer because it takes the battle right to the front. I mean, these are my GP friends who are manning the clinics, who are seeing people with COVID-19 at the early onset. They can immediately see, assess the risk, and if the individual is at high risk of progressing to severe form of it, where you need hospitalization, oxygen, and perhaps ICU care, then you can actually administer the medication and prevent that. So it is a game changer because we don't have to wait for things to happen. You anticipate and you strike while the iron is still hot.
Dr. Leong, is this treatment or any other treatment, effective treatment, the next step in the fight against COVID-19?
It is a very important next step. Look at influenza, for example. We can help control influenza with vaccines, and when that fails, we have the oral treatment which can be served by the GP clinic, and it makes control influenza so much easier and so much better. And this drug, besides going for just treatment, they are trying to get indication, trying to get approval for prevention, or what we call prophylaxis. But I want to remind all the readers and viewers down here that the drug is not termination to everything. It is a useful armament in addition to the vaccines which we have. Vaccines are still more effective, a lot cheaper, and prevention is much better than cure. So I'm going to urge everyone again, if you're not vaccinated, get vaccinated. If you're entitled to boosters, please get your boosters at the government vaccination centers. The mRNA vaccines have been shown, tested, proven to be very effective in preventing hospitalization and deaths after COVID-19 infection. Get boosted, get vaccinated. That is still the best measure.
Well, thank you so much for sharing your insights, Dr. Leong. That was Dr. Leong Ho Nam, an infectious diseases specialist from the Rofi Clinic at Mount Elizabeth Novena.